technological difficulties. Sometimes they follow me around. I want to thank Martyrs, especially Nadia and Manada, for their invitation. I actually participated in the very first one 2 years ago, is that right? And it was a really wonderful experience. I'm really happy and excited to see it continue to grow and do so much important work in the community. So I'm going to talk today about a project that I curated called Open an Emergency. We have it in a box right here for folks to look at. And just a little bit of warning that I start the talk with suicide. For the last 6 years, I've taught a class on the experience of second-generation Asian Americans, the children of immigrants and refugees. My story. The story of so many of my students are stories of life and of death. I start the class with 2 days on suicide. A text that I teach across all my Asian American Studies classes is Lisa Park's essay, Letter to My Sister, a letter written shortly after that sister's suicide. And I often teach an essay I wrote in response, describing my own experiences of surviving postpartum depression, contemplating suicide, and entering a new world structured by depression, exhaustion, dread, the intimate knowledge that there are structures and people on a mission to see me die. I'm not crazy, but sometimes it feels like I am. The illegibility of the violence striating my life is a chokehold. When no one around you sees or understands, when they all turn away from what is happening to you, when you are the only witness to your premature dying. Lisa Park tells her sister she wasn't crazy, even for committing suicide. That the madness that drove her to suicide is a madness born of violence. Madness as a condition of life under siege, as a second-generation Asian American woman. Madness that is evidence not of her personal failure, but the failure of the world around her. A world shaped by her, a world that shaped her immigrant parents into both accomplices and victims, investing in the civilizing terror that is Americanization, model minoritization, driving themselves and their daughters to shattering heartbreak, all in the name of the American dream. Those of us living and dying under conditions of structural violence, those whose vulnerabilities are exploited to the point of premature death, and that is how Ruth Gilmore defines racism. Those who, Lord knows, were never meant to survive, we know that we are trying to be sane in an insane world. We know that madness boils around us, seeping into our pores, our veins, the crevices of our minds. We are filled by it, by despair and rage and heartbreak and fear and loss and exhaustion and exhaustion and exhaustion. Madness is the psychic and affective life of living under siege. And so I started a project that we would end up calling Open an Emergency, a project on Asian American mental health that sees every day as an emergency, as a crisis of mental health, especially for communities under siege. Because what does mental health look like when we live within social structures that are trying to kill us? Open an Emergency explores this question as an arts and humanities intervention that decolonizes mental health. It asks us to reconceive mental health in the context of historical and structural violence, and in the context of community meaning-making and practices of survival. It asks us to shift away from traditional models of wellness and unwellness that have historically been structured by and work to bolster whiteness and white supremacy, capitalism, and empire. It asks us to look in different places, ask different questions, make visible different things. It asks us to think and feel our way out of circuits that are killing us. The World Health Organization defines mental health as a state of well-being in which every individual realizes his or her own normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. In Open and Emergency, several contributors directly engage this definition, pointing out its emphasis on work, its conflation of wellness with productivity. Is our health and value really determined by an ability to be productive, to participate in capitalism? Here, capitalism provides our frames for measuring our health. Indeed, it frames it precisely in ways it can use, extract, exploit. In her essay, The Myth of Mental Health, Kai Chang Tong writes, "Mental health was invented to sell us something. It is the language of power, the power to exist within and sometimes define the conventions of sanity, normalcy, the status quo, capitalism, white, heteropatriarchy." Mental health, then, is a normative construct, meaning an ideal that defines for us how to be what we're supposed to become. In sick woman theory, Johanna Hedva shows us a dangerous consequence of this construction. They write, "What is so destructive about conceiving of wellness as the default, as the standard mode of existence, is that it invents illness as temporary. Care in this configuration is only required sometimes. When sickness is temporary, care is not normal." So this is neoliberal capitalism. Wellness as the normal state of being, illness, and only recognizable ones, as aberration. Thus care as aberration. So this means that humanity requires nothing to sustain itself. Humanity is owed nothing. We owe each other nothing. We owe ourselves nothing. Johanna Hedva asks us to do an exercise. Go to the mirror, look yourself in the face, and say out loud, "To take care of you is not normal." I can only do it sometimes. This seems a strange and awful thing to say to yourself, but is actually what the world says to us every day. Okay, so back to the World Health definition. Mental health is a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life. What are normal stresses of life? For whom are they normal? Who gets to deem certain stresses as acceptable and other kinds as too much, beyond some imagined threshold? Who gets to tell you what you should be asked to bear? Who gets to tell us how we must bear our burdens, what kinds of coping are healthy? Vulnerable communities have always been asked to bear too much. They have also always generated strategies of survival, both compromised and breathtaking. I started this project in order to take stock of what we've been asked to bear. What has been too much? What have we done or are doing in the face of too much? And I found we need to look in new places, different places, to understand the scope and depth of the forces that structure Asian American life, and of the possibilities of agency and meaning therein. What hurts? Asks literary scholar Erin Ning, and I follow that question with, how do we go on living while it hurts? So what are some places to look, some ways of looking? Perhaps not in individual pathology or maladjustment, but in the everyday burdens that structures give us. Perhaps best told in stories, in intimacies, in wounds, in crises of meaning. So we hacked the DSM. Everybody here knows what the DSM is, I presume. So we asked, what would a diagnostic and statistical manual of mental disorders look like if it was about Asian Americans, by Asian Americans, and from an arts and humanities approach? What kind of vocabulary would we develop for understanding wellness and unwellness in our communities if we took this untraveled route? So we made a mock DSM Asian American edition. So to be clear, we know there is not an actual Asian American DSM. If there was one, it would be shitty, and we have to hack it anyway. So we pretended that there is one that was shitty, and then we hacked it. Framed, and this is what you can do in the arts, or to make shit up. So we framed as if we had taken an actual DSM for Asian Americans, tore out all the pages, and inserted new ones. We opened the mock DSM with these lines from Lisa Park's letter to my sister. Why would you want to place yourself in the hands of an institution that seeks to re-socialize you into the environment that made a mess of you in the first place? Our inclusion into the American process turned out to be our worst form of oppression. Most people are proud to call themselves Americans, but why would you want to become a productive, well-adjusted citizen when the primary requisite of Americanness is racism? Isn't our madness often the only evidence we have at all to show for this civilizing terror? So everything is here in these lines, the primary requisite of Americanness as racism, meaning that being American requires both being subject to racism and participating in it. Racism as encoded in our every institution, including the psychological and the therapeutic. Our madness, our individual and collective unwellness, is often, as Lisa Park writes, the only evidence we have to show for the terror of racialized life. The terror of being a person of color alive in a world that simultaneously demands we be white and blames us for not being white, when of course we can never be white. The DSM opens with these lines to situate Asian American life, Asian American unwellness, first and foremost in this context. Again, I ask, what is mental health while living under siege? So our DSM is a collection of essays, visual art, stories, and practices that build out a complex picture of Asian American wellness and unwellness. So already sound probably very different than the actual DSM. We have a methods section. Its entry titled Methods Diagnosis asks how one is to study mental health. Is it simply to measure ourselves against that World Health definition of productivity? How well we function and fit in, how far we deviate from that which is deemed normal. Is that how we measure health? Or is it capturing our felt life in all its messiness and awfulness and beauty? The section, curated by Erin Ning, asks 5 scholars to reflect on the tools of their disciplines, to articulate the frameworks and instruments they use for what she calls sussing out the truths of suffering, and to weigh these methods' strengths and weaknesses, their assumptions and limits, what they're able to capture and reveal. We'll go through them very briefly. Eileen Duldalau criticizes the medical positivism of psychiatry, the circular logic of measurement and proof, meaning if it can't be measured, it doesn't exist. And the violent process of ordering, of labeling, that is psychiatric diagnosis. Laura Uba points to the value of the qualitative, and Erin Ning the value of stories. Erin Ning writes, I am a phenomenologist, someone who treats the consciousness like litmus paper, a diagnostic, reading where it colors, crumbles, fails to respond. I am a die-hard for the practical value of what literary criticism can do to diagnose pain and sound out our healing. She's a literary critic and wants to think that as a methodology for mental health. Eliza No coins the term suicidology, the study of suicide on its own terms, the interdisciplinary investigation into what makes lives feel unlivable. Jim Lee tells us to focus on narratives that tell stories of being unable to move in the world, because these invite us to bear witness to the loss, the trauma, the ordinary betrayals of institutional failure. This failure feels like a loss that demands grieving, and yet too often that feeling isn't recognized. Interdisciplinarity and humanities race-based approaches. This is actually deeply threatening to the psychological and psychiatric establishment. The entire idea of the DSM out of the hands of those who claim not only the highest expertise on mental health, but often the only expertise. This is deeply threatening. And I'll show you an example. This is an email we received after we announced the launch of this special issue, Open Emergency, from an Asian American psychiatrist who had not yet read the issue, only our announcement. Oh, a very small font, I'll read part of it out for you. Dear editors, as someone who has devoted my life to bettering mental health, who also shares great concerns with the Asian American community, and a writer myself, I was initially very excited to see your special issue project on Asian American mental health. However, I am somewhat concerned. I don't think I see anyone who seems formally directly involved in mental health care itself, like a department of psychiatry or psychology or a licensed professional. I could be wrong, I haven't looked through the entire list yet. But if this is the case, it seems like a huge missed opportunity for direct outreach and collaboration with providers who could actually bridge the well-known gap and stigma between Asians and mental health care. I realized the project was mainly literary artistic in intention, and probably a gathering of first-person stories. And as a writer myself, I love and respect that idea. But when I see a rewritten DSM as one topic, even if tongue-in-cheek or as cultural critique, I really hope that the information you're disseminating has some basis in actual psychiatric, psychological research and science. There is so much misinformation and stigma out there about mental health as it is, particularly among the Asian community, that I would hope this project involves some discussion and collaboration with those who have actual scientific expertise. My questions and concerns might be moot since I have not read the issue yet. I'm just asking ahead of time for any future initiatives you may be pursuing for mental health, that you make sure to include reach out to the extensive mental health provider and academic community, which will ensure Asian Americans whose mental health needs are so often ignored and neglected get the appropriate resources they need. Best wishes, Clinical Professor of Psychiatry. So I'm a humanities scholar. So we're going to close read the email together. This is what we do with texts in the humanities. We close read them and analyze them. So she writes, I don't think I see anyone who seems formally directly involved in mental health care itself, like the primary psychiatry or psychology, who could actually bridge the well-known gap and stigma. Information has some basis in actual psychiatric psychological research, those who have actual scientific expertise. Okay, so what do we see here? What are some of the kinds of assumptions and assertions that the psychiatrist is making?
That only the psychiatrist would know what you can do.
Right, so who are the experts? The experts are psychiatrists and psychologists, and they're the only people who can actually, it's also actual research, actual scientists, so who are the people who are experts, the psychiatrists, psychologists, the ones who can actually do it? I'm sorry?
Do you have the information to back up what you're saying?
Right, so questioning our authority and whether we have information to back up what we're doing. Science as the foundation of knowledge, right? Only scientific knowledge counts. And then a collaborative work cannot be responsible unless it engages the true experts of mental health, psychologists and psychiatrists. And that art and literature can only possibly be a gathering of first-person stories, and that's it, and don't have any value compared to actual research. So my partner, Lawrence Monroe Davis, is actually the editor-in-chief of the Asian American Review, which is what published this project, and he answered this email, and he asks that whenever I do this talk, that I show what he wrote back to the psychiatrist. So I'll share his email here. I'll read parts of it as well. We hear and understand and admire and share your concern about how responsibly any project that tackles Asian American mental health takes its work. Some of your language in your message, and please correct me if I'm wrong on any assumptions I'm making here, suggests though that we hold pretty different notions. AALR, that's the organization, is not of the mind that psychological research is the only or even best form of knowledge production when it comes to mental health. So much space has been given to that form of production, and our aim is precisely precisely to make more space for other forms, work by visual artists, literary writers, practitioners, survivors, and other kinds of scholars. We also want to draw attention to the limitations and failures of psychology as a field and industry when it comes to its incomplete and sometimes violent lenses on race and queer and trans experience, for instance. Checking our credentials to make sure that we include psychiatrists and materials based in psychiatry is pretty clearly privileging one form of knowledge production over others, and it feels like an invalidation of other forms, as well as the people and communities for whom those forms are important. There's a difference between asking for accountability and policing what counts as valid and who gets to speak. So the psychiatrist is very unhappy with this response, claiming she approached us in good faith and we responded with hostility and defensiveness.